Dr. Richard O'Reilly pioneered the development of curative bone marrow transplantation for patients who lacked matched donors, dramatically expanding the number of patients who could be treated, improving their survival and quality of life. Born in Brooklyn, Dr. O'Reilly was raised in New Jersey. He attended Xavier High School in Manhattan and did his undergraduate work at the College of the Holy Cross. He received his medical degree from the University of Rochester Medical School. It was there, under the tutelage of John Vaughan, that he developed his interest in the budding field of immunology. And as an intern at the University of Minnesota, he continued to explore the field, working with Robert Good. He completed his residency in pediatrics at Boston's Children's Hospital Medical Center, and then did specialty training in infectious disease. He joined the staff of Memorial Sloan Kettering in 1973. There, he was involved in the first transplant of bone marrow from an unrelated donor to a patient. The success of this procedure, along with Dr. O'Reilly's other laboratory and clinical research, led to new therapies for children with genetic immunodeficiencies, patients with leukemia, and other life-threatening blood diseases. He and his colleagues also developed and introduced methods for removing T cells from the donor's transplant. This approach proved to be an effective way to prevent the dangers and complications from graft versus host disease. His work also led to new immune cell therapies to manage other complications of transplantation, such as Epstein-Barr virus lymphomas and cytomegalovirus infections. As a result, bone marrow transplants, both autologous and allogeneic, are commonplace. They are used to treat a range of genetic immune deficiencies, leukemias, and other diseases of the blood. Diseases which were once fatal are now manageable. The 2016 National Physician of the Year Award for Lifetime Achievement, Dr. Richard O'Reilly.
I want to thank Dr. Morgan, and I want to thank John Connolly and John Castle for this extraordinary honor. I was a little, to say the least, as Dr. Operl said, blown away to learn of this and particularly to be here tonight. I have had an extraordinarily lucky career and extraordinarily, I could never have imagined as a medical student that life would turn out the way it has. I started on this journey in transplantation in 1968. You saw the smiling picture of Robert Good, who was into this, in particular the idea of matching for histocompatibility determinants within the family. That patient remains entirely well, lives up in Connecticut, and the only thing that's unique about him is that all of his blood cells are female. They're all derived from his sister back in 1968. So I was infected early. And when I came to Memorial, I had the good fortune to interact closely with a genius of immunogenetics named Beau DuPont, who had the vision that transplants could be applied outside the family. And from that came his long analysis leading to the identification of a first unrelated donor. And so we transplanted marrow from a woman in Copenhagen to a young child with the so-called bubble baby syndrome, a child with immune deficiency who came from Ohio. After that, we all thought that we would find unrelated donors for everyone, but such was not the case. However, as you all know, now through the work of one of his students, John Hansen, and along with the father of a patient who ultimately died following a transplant, we now have what is called the National Marrow Donor Program, with 31 million donors worldwide, and we're doing transplants from unrelated donors to the tune of about 5,000 patients a year. We developed subsequently approaches for patients lacking a donor. And for that, I want to particularly acknowledge Yair Reisner, who is a professor at the Weizmann Institute, who had done some extraordinary work in mice demonstrating that if you remove the immune cells from a transplant, you could transplant across genetic barriers. And together we were able then to apply this also to kids with immune deficiencies and on into patients with leukemia. Over the years, we've developed a variety of different approaches for transplantation. I am overwhelmingly indebted to an extraordinary group of physicians, nurses, and other staff who constitute the transplant services at Memorial Sloan Kettering Cancer Center, some of whom, like Sue Prokop and Fareed Boulad, are here tonight. I also have recently had the privilege to develop these immune cell therapies with Katya Dubrovna, Sue Prokop, Gunther Kerner, and Aisha Hassan. Two of them are also here tonight. This has allowed us, as it were, ultimately now, the idea that we will have off-the-shelf immune cells that can be used to treat life-threatening infections around the world. I also have the good fortune to work with the man who nominated me for this, namely Jose Bazelga, who is the physician-in-chief at Memorial, and the extraordinary good fortune to work at Memorial Sloan Kettering Cancer Center, which throughout its history has never once gotten away from what its logo was about, the conquest of cancer through patient care, research, and education. And it's because of that extraordinary place, with its entrepreneurial push, with its constant and glorious commitment to translate discovery into meaningful therapies for patients, that is what has basically been able to sustain me. I have also had the extraordinary, just wonderful time of running a department of pediatrics, which again is gifted by extraordinary physicians and nurses who have done a lot of very innovative things that have very much changed the natural history of kids with cancer. Naikang Chung, who's done brilliant work in neuroblastoma, Mike LaQualia, an extraordinary surgeon, and so many others who have really done wonderful things for the kids that we deal with. I also want to thank tonight Nina Pickett in particular, who's my right arm and administrator. What that has meant, and we were talking about this before, is the fact that anyone who is trying to do something worthwhile has got to have the time to think. Without Nina, the likelihood of thinking would be very, very small, at least in my particular office. I also want to thank especially the patients who entrusted their lives to us and encouraged us through all times. And I remember in the early days of transplant, a woman who was transplanted for aplastic anemia coming out from a row of 7 isolator rooms saying, "We all talked and we agreed if one of us survived, it was worth it." That type of patient is a patient that is something extraordinary and something really wonderful. I'd also in particular like to talk about my family, my sons, John and Stephen, and particularly my wife, Jean, because she's been a constant support. She's had this extraordinary capacity to maintain an enabling equilibrium for me, and periodically she reminds me of what's really important in life. And so I thank all of you. I am deeply honored. On behalf of all our patients, our doctors, and otherwise at Memorial, I just want to say thank you very much.